Warning, please do not use or derive concepts from this video to try answering questions and incorporating it into the steps of a diagnostic approach to a patient. So today I'll be talking about water bending from Avatar: The Last Airbender. So before I move on, I'll talk briefly about the four elements and their properties. So water can be controlled distally. So like the water bender can be 5 feet away and not touch the water and still control it. Same thing with earth bending. They can be like 5 feet away and not touch it, and it's very malleable. They can still control the rock from far away. However, air bending has to be touching the user at all times. So if, let's say, the airbender was in space and they had an oxygen tank that was like 5 feet away, they would not be able to move it. Firebending is kind of like airbending as well, where the user has to be intact with like the airbending as well. It has to be intact with the fire for the most part. They can, however, control like a flame if they're nearby. So let's say there was a candle, the firebender can increase or decrease the size of it, but for the most part, the fire has to be ejected out of the body of the user. So the pros of water bending is like it can be used sterilely on like most patients in the operating room, unlike air, because air is usually going to have to be touched by the person operating, and this would also cause like a lot of havoc in the room just because air might blow away tools. You may lose things at times, and this can cause a lot of confusion. Another thing with water bending, you can control like hypo and hypernatremic states. So a lot of people have get confused about how to treat hypo and hypernatremia. For the most part, the best way to remember it is always treat the volume status before you treat the electrolyte status, unless it's like an emergency. And be careful when you're giving like hypertonic saline, just because you can lead to the complication of central pontine myelinosis. And usually to treat like the a hypovolemic state, you don't usually give like hypotonic saline. You give isotonic saline with glucose, just because you want to correct the volume status. And like glucose and sodium, sorry, glucose and saline would be absorbed together much quicker just because of GLUT channels. And one thing with catheters, they'll be obsolete in many scenarios, except when you want to record how much the patient is like able to urinate. And pregnancy would be it would be very helpful for pregnancy, just because you can get rid of kidney stones as well, which is common. I'll talk about those later. And in pregnancy, there's like placenta abruptia, and this is usually, let's say this is the placenta, and if there's oligohydramnios, which means very little fluid, there won't be any pressure to decompress like the outside of the placenta. So like the pressure would go inwards and cause it to rupture. So that's why you want to always keep fluid. So maybe a water bender can like cause like stiffening of water, like ice in certain areas, not fully frozen, just to help support it and prevent like ruptures. Another thing would be like a breech. So they can maybe use like internal rotation just to prevent like baby from coming out in the breech position, and they don't have to like try external or like a C-section, and they can still have a natural birth. Usually at 38 or 39 weeks, you can try externally rotating the baby out of the breech position. If not, you have to do a C-section. Another thing is like you can move like the blood clots back and forth and like cause it to rub against the blood vessel and just dissolve if you can locate it. Usually you can locate it on ultrasound. And Dopplers would probably get highly developed if water bending was to take over medicine. So Dopplers would have to be much more sensitive, just because like water bending is becoming a prevalent means. And water benders, they can bring temperatures downwards, but they can't really go higher than room temperature. That's why you can treat hyperthermia, but you won't be able to treat hypothermia unless it's very mild. So there's blood bending. This can be used in many cases, but it's a very rare ability and requires high mastery. It may become more prevalent like metal bending did in future generations of Avatar, but however, currently it's very rare. So there can also be, you have to watch out for like the risks of cancer, because rapid regeneration, yeah, this is also a rare ability, but it's much more common than blood bending. And so, oh, rapid regeneration can cause cancer. So that's why, even in today's world, well, the real world, there's no rapid regeneration drug due to like the possibility of cancer. And you would have to also tightly monitor, just because, again, waterbending is very prevalent. And they'll probably have better tools for that too. So other elements can also be used. So in cutting, I understand there's some scenarios in the operating room where you use water to cut it, but this is kind of like, maybe it's very hard to control and you don't want to take the risk with it. And same thing with fire, you don't want to cause burns, and fire is a very erratic element and you don't want to use that. So the best thing would be to use metal bending, and maybe some other earth compounds as well may be used and like researched into. And one thing with the tools is like, you won't need to like, you can change the tool. You can just give the metal bender a block and just tell them, hey, make me a Corker or a Kelly and whatnot. And you can just, maybe you can put like 2 clamps on like one tool and force the clamping and whatnot. And stapling would be easier too. Lithotripsy would be important as well. And like, this can also be done by water, but water, it would be a little less safe, just because if you exert too much pressure on the stone, this can also be done for gallstones, by the way, and biliary sludge, it can cause it to move out quicker. However, lithotripsy, you have to still be careful of how much pressure you're exerting, because you don't want the shards to go everywhere and cause maybe like renal damage, and so you have a much worse problem than the stone. So another thing would be, metal benders can cause metal stents and valves, like it'll be easier and more malleable. So even if they get coagulable, you can cause like some bending to occur of the metals, just so you can decrease the chances of having a clot. And you may not have to take as much anticoagulants as you would have to with a metal stent or valve. And IVC filters, they would be easier to put and remove. These are rarely put in, but once they are put in, they're rarely removed as well. They're most likely, when you put them in, they're in for life. They kind of look like this, and then there's like a metal from the side, and then it depends. Some have one or 2 portions, like this on the anterior, this on the posterior side. They catch the clot, and then it dissolves due to the mechanisms of the blood vessel. So if you wanted to put it in, you can put it through the IVC facing upwards, facing like this, or you can put it through the inguinal area and through the femoral, and then reach upwards. But if you wanted to remove it, you have to go through the IJV. So the way you would remove it, there's 2 techniques. So usually the snare is also has a guiding wire with it. So it comes through here, through the IJV, and then you extend the wire here, and then the snare is kind of like a claw, and you can grab it, and then once it's grabbed, since it's all attached, you can pull it all the way up. That's one method. Another method would be the IVC filters here, right here. And then you get here and directly grab it. So you can use this method, but if you have metal bending, there's no need for all this extra stuff. You would just have to make a slight puncture, and then you can just guide it through very carefully with metal bending. Or you can just send whatever metal you want, and then once it gets down there, you can just form it into this shape. Another thing would be not cardioversion, but like better defibrillation, just because I think it would be kind of difficult to get the exact area where you have to use electricity. And in very rural areas, like since where power outages may be common, you may want to have like an emergency lightning bender on standby just in case. And muscle and nerve stimulation, there would be good use for that with lightning bending as well. So overall take, I think water bending and earth bending are good for the most part. Fire and air are pretty much useless, just because hygienic reasons and like the erratic nature.